in the beginning by Ministry of Health and Family Welfare, where it is mentioned that the post-COVID management and care should include yoga and some Ayush systems. It has now come out today, as I mentioned. It is dated on Sunday, so the healthcare officials are working very hard. And you raised some very good questions pertaining to neurology and cardiology, and we are happy that we have both the experts on our panel. But we'll first move to the heart cardiologist, Dr. Susheel Sharma. And I was just wondering when Dr. Raju mentioned about the cardiac problem, whether it is endocarditis or whether it is just palpitation, whether it's pulmonary edema or it is just breathlessness, how to tease that out. So maybe Dr. Susheel will shed some light on that. I will introduce Dr. Susheel Sharma, who is a board certified cardiologist at the Washington Medical Center in Maryland. And he's also fellow of the American College of Physicians and has worked for 25 years in interventional cardiology. And after 25 years, he has shifted gears and now focusing on cardiac wellness and on focusing on stress reduction techniques such as yoga, pranayama. So, Dr. Susheel, we look forward to your ideas and thoughts and what your experience of 25 years has told you and how we can manage post-COVID scenario, both in India as well as USA. Welcome.
Thank you, Dr. Anand. Thank you for a very profuse introduction. I'm grateful to you all for sparing time to come and listen to us all. And I'm also grateful to American Academy of Yoga and Meditation to provide the platform. And I'm also very grateful to be sharing this screen and space with the luminaries that you're seeing on the panel. And Dr. Raju beautifully touched upon the cardiac side, the pathophysiology, and he really explained the underpinnings of the ravages of the virus on the myocardium. I was also touched by his personal story, which is anecdotal but very moving. And that can happen to anybody in post-COVID state. And therefore, to what extent and in what fashion and manner one should introduce the practice of yoga, that's something that I will allude upon during the presentation. I have a small slide presentation that I'll begin. Let me share my screen with you. Okay, can you all see it? Hello?
Not yet.
Okay.
Yes, this is fine.
Okay, great. Okay. So since we have panelists from diverse specializations and Dr. Anand from neurology, I'll just stay focused on the cardiovascular side. But before I go to post-COVID management, I'll just briefly touch upon the benefits of yoga for cardiac health, which all of you are aware of, but for the benefit of the general audience. The benefit from these practices of yoga, dhyana, pranayama comes with regards to heart through two mechanisms. There is a clear evidence in the science that various modalities of yoga, dhyana, pranayama act upon risk factors in diverse ways and help to reduce heart attack and help to reduce the incidence of heart disease. You're all aware of the beautiful effects that the yoga meditation can have on blood pressure, cholesterol abnormalities, and diabetes control, and also facilitating and motivating to quit smoking, which in itself has a risk factor modification effect that brings about the good health. There are also specific studies that have been done, especially in arrhythmias, and you may have heard Dr. Raju alluding upon the heart rate variability, which is the underlying mechanism of how yoga helps in reducing the frequency of atrial fibrillation. There have been studies in cardiac rehab showing that there is an improvement in exercise capacity, and in heart failure patients, there's also improvement of quality of life. And Dr. Raju also talked about the immune mediators of infections, including the IL-6 and the TNF alpha, and all these different immune mediators are actually reduced. The inflammatory markers improve with continued practice of yoga meditation, and that's another way it protects your heart. Meditation, again, has several benefits, and one is obviously the arrhythmia prevention. But there's a beautiful study that came out in 2013 on heart rate variability, how important it is to improve your heart rate variability. People that have a very low heart rate variability have 30 to 40% increased risk of heart attack and stroke. And heart rate variability really is a beat to beat variation in your RR interval. It should not be confused with variations in heart rate with exercise. It's actually an algorithmic quantitative measurement that you can only do with certain devices and instruments that are available. And now they're actually also available in app form on your cell phones these days. And there is clear benefit of meditation through TM study that it helps reduce the blood pressure. Pranayama also has a salutary effect on autonomic nervous system, and it restores balance of parasympathetic versus sympathetic nervous system. And as you're all aware that if there is increased parasympathetic activity, there is improvement in your systolic blood pressure, diastolic blood pressure, your heart rate goes down, your respiratory rate goes down, and your heart rate variability increases. And all these are beautiful effects on your heart. So there's no doubt that yoga, dhyana, and pranayama is an integral part of cardiac health. And just like in a normal person with no disability or no infection, it helps. It also will help in post-COVID patient. I must admit, we do not have any scientifically validated data on that at the present moment because, as you all know, the epidemic is still young and ongoing. And I'm sure as time goes on, there'll be multiple studies published post-COVID. One thing important is that when you start post-COVID, yoga, dhyana, and pranayama, there are certain guidelines that have come. And the guidelines have come from American College of Cardiology, but they are pertaining to physical activity, which I'm translating for the ease of presentation into meaning the yoga asanas. The meditation, to my mind and intuitively, I think one should do all the time. It's safe during infection, during convalescence, during recovery. And it's a good practice to pursue meditation at least a minimum of 20 minutes a day, if not more, for cardiac health. And there are multiple studies on that, on the benefit of that. So meditation in any phase of pre and during and post-COVID is very safe. Pranayama, again, for sake of convenience, and this is, again, my simplification, I somehow divide it into two groups. There are simple pranayamas like what we do, like Anulom Vilom, Bhramari, Udgit, Pranav. These are really pranayamas that have some respiratory component, which is not very extensive, and also there is practically no physical component. So to my mind, they can be continued post-COVID without any restriction. I have some reservations about, for sake of convenience, again, I classify that as advanced pranayama, like Kapalbhati or Bhasrika or Agnisar. Now, they clearly have a physical component, and they clearly, during the phase that you're doing it, you are challenging your cardiorespiratory system. And they should be classified same as yogasanas, which are more physical. And for that, I suggest the following guidelines as to how and when you should be introducing this in post-COVID phase. So this is from a presentation on exercise and athletics in COVID-19 patients from American College of Cardiology, but I think it's very translatable to yoga also. If you are asymptomatic and you were just tested COVID positive, you fall in group 1. So if you are COVID positive, you should still wait for about 2 weeks before you begin yoga and physical activity. You should continue for late onset presentations. And at any point where you notice breathlessness, increased heart rate, palpitations, chest pain, reduced exercise capacity, of any of those symptoms, you must pause and you must seek guidance from a healthcare team. If you have been tested positive for COVID-19 and you have also had mild symptoms, you fall into group 2. Again, you have to wait for 2 weeks convalescence after symptom resolution, but it's important that you check your troponin levels at least one time. you have an EKG performed, and if it's financially and logistically possible, probably also obtain an echo to make sure that you have not developed asymptomatic myocarditis. And that is the reason why exercise is delayed in myocarditis patients, because extensive physical activity in early phases of myocarditis, if continued, can lead to a greater myocardial damage. If your troponins were negative and your EKG is unremarkable and your echo shows no abnormalities either in the endocardium, myocardium, or in your valves, then you can gradually and slowly start increasing your activity. But if any of these parameters is positive, indicating that you may have contracted myocarditis from the virus, then you really have to follow the myocarditis physical activity guidelines, which means that you should really wait 3 to 6 months before you really start doing physical exercises and complex asanas. But again, as I mentioned earlier, you can always continue to do meditation and have its benefit, and you can continue to do simple pranayamas. And the third group of patients who actually become COVID positive have significant symptoms to the extent that that results in hospitalization. Now, these patients obviously in their in-hospital phase will have the troponins measured. They will at least have an EKG performed. And if there are significant abnormalities observed on the EKG, you may also end up having an echo. So if their troponins are normal, EKG is unremarkable, and the echo shows no evidence of endocardial or myocardial damage, following discharge, they should still wait 2 weeks, but again, be reevaluated physically at least by a physician before initiating physical activity in yoga, and should start slow and continue under close monitoring. And if at any stage during this phase where they have resumed their physical activity in yoga, if they become symptomatic, and again emphasize symptomatic means either shortness of breath, chest pain, palpitations, dizziness, fatigue, reduced exercise capacity, they need to be reevaluated by the physician to restart physical activity and yoga again. So thank you very much, and thank you for listening. And I'll be happy to take questions, or I'll pass you on to Dr. Anand.
Thank you. Thank you, Dr. Susheel. Your views were also echoed by one of our viewers, Krishna Goyal, who said, yes, there is a lot of weakness post-COVID and they may avoid asanas. But very, very interesting. You nicely categorized the group into a group 1, asymptomatic, 2, a little more milder, and the third. I believe this is inspired by the American College of Cardiology recommendations for exercise, and presumably this is your empirical advice for yoga and asanas, correct? And we'll have more views and discussions on this very important presentation by our next speaker.